I'm Jim Minow, and I'm the executive director of the Cure JM Foundation. I'm entering, this is really hard to believe, pretty close to my 10th year here at Cure JM. I'm fond of saying that I am employee number 2, and Shannon Malloy is employee number 1 of Cure JM. And I mention that because because one of the things I like our families to know is that we have an extremely stable staff, which really leads to a real sense of stability and accomplishment in this organization. I think Shannon, if you want to advance a couple of the slides, that really just want to mention since our founding in 2003, when we were really an organization that was 100% volunteer driven. Cure JM has invested more than $27 million in research and clinical care in the United States and abroad. We've funded some 219 research projects and have connected 3,000 families around the globe over those years in our mission. I want to thank all of you in particular because without you as volunteers, and I know we have some board members on the phone as well, or on the Zoom tonight as well, we simply could not accomplish what this organization has accomplished in our 21 years of history. We're kind of fond of saying that we're the largest JM funder in the world. That is actually true. I think without this organization and the commitment that families have brought to this organization over our history, we never could have achieved the kinds of things that this organization has achieved. We could not have improved the quality of care and therefore improved the quality of lives of children and adults who live and hopefully one day will find a cure for this disease. And indeed, as you'll hear a little bit later from Andrew Heaton, our Chief Science Officer, that indeed we are closer and closer to that really rarefied objective of finding a cure for this disease. I like to say also that we that's all right, Shannon, go ahead, please. That we are really good listeners in terms of determining where we spend our research dollars and what it is that we want to achieve that is of the highest interest to our families. Most recently, Shannon and her team did a survey of many of our Cure JM leaders. These are the top priorities that have come from our families: a cure, better treatments. We're focused laser-like on both of those. Predictors of flare and causes of JM, a real important basic research aspect of what we do as well, and improved care for patients. You'll hear a little bit more from Shannon about our clinical care network now moving into to its 3rd year of existence since we founded it a few years ago, and it has really already made a substantial difference in the quality of care that patients receive, and I think most importantly, as we begin to expand out to other areas of the country where Cure JM has not historically had a presence, finding ourselves in, with a significant presence now in places like Southern California, Texas, the Midwest, the Northeast, and other areas that are major population centers where we know there are significant numbers of families who are wrestling with this disease. What I've really seen, I think most recently, and I would say this over the last couple of years, and I really am most proud of this achievement from our staff and from our board of directors, is Cure JM has really emerged as a leader in the field of pediatric rheumatology research. And by that I mean across, in many ways, all fields of pediatric rheumatology research and other diseases such as pediatric lupus, as an example, juvenile arthritis. Many of these diseases, which are more common than JM, share the same doctors, and share some of the same therapies. And what I've seen really happen within Cure JM, over this, past decade, essentially, but really, I think more or less in the last 3 to 5 years, is that those doctors and medical facilities, our researchers, our research staff, the medical administrators, the other organizations that we partner with in pediatric rheumatology have really come to see Cure JM as a groundbreaker, as a leader in the field, where we are not only a significant funder, but our researchers and the research that we fund are very much on the cutting edge of any research that's being done in pediatric rheumatology, which when you think about it, for an ultra rare disease like JDM, and a relatively small organization, our budget is about $2.5 million a year. That achievement to emerge as a leader in the field is something I think all of you can be very proud of. Our researchers really do represent, in my view anyway, the best of the best who are out there. They are grateful for our support, and of course we can only provide them with that support because of the support all of you and our families have provided to this organization over the years. Our grant program is also very strong. We have in any given year about $4 million in outstanding grants that are at work across roughly 20 institutions, mostly in the US, but also including institutions in Canada, the United Kingdom, the Netherlands, Europe, and most recently we made a significant grant to a group of Japanese researchers that I think will be also quite important to the expansion of our knowledge and the expansion of our work to families who are overseas and outside of this country. Andrew may talk about that a little bit later. So I look at this very much as kind of what I think of as the quality of the company that we keep. And that quality is represented by, I think, the most prestigious research institutions that you can find anywhere in the United States or across the globe. They include institutions like the University of Michigan, Duke University, George Washington University, UCLA, another one on the West Coast, Baylor, Texas Children's Hospital. The list kind of frankly goes on and on, but these are major partners that also allow us to leverage our resources, the resources that you provide, in very dramatic ways. And ultimately, those successes turn into larger successes when our researchers are able to, because of our early support, attract significant grants from the NIH, larger grants than we can afford to give them, or more recently, as represented by the $2 million plus grant that we recently received along with the University of Michigan and the University of California, San Francisco, and Duke University, a major grant from the Chan Zuckerberg Initiative out of California. I think Andrew will probably talk about that a little bit later as well, really looking into the cellular aspects of this disease and how that might help us move to more precision medicine. In terms of the year ahead, we're looking forward to what will, I believe, be an awesome family conference in June. Starts on June 28th in Chicago. We are pretty fully subscribed to this conference already. So if you're interested in attending the conference and have not registered, please do so quickly. You can find registration information on our website, www.curejm.org. We will also have an extraordinary lineup at that conference that will be equal to the astounding lineup for those of you. I know we had a couple of board members who were on our Clinical Care Network Summit today, which is essentially a training program that we do for doctors around the country. We had about 100 doctors go through this 3-hour training program today, hearing from 5 of our research superstars who were presenting on really research outcomes and how those outcomes impact your family and impact and increase the quality of care that you are getting. We've also launched and are a leader in mental and emotional health for adolescents and adults, but really focusing on families and the mental health challenges of managing this disease, especially for young children, and have made some significant advances there as we look to incorporate mental health more significantly into the day-to-day operations of our clinics around the country. As I mentioned a little bit earlier, relative to our investments in research, also want to say that we're a very financially responsible organization. We have a very healthy balance sheet, and so we will be in a position to continue to invest and expand that research portfolio and expand our clinical care network based on the assets that we have and the excellent management of those assets that the management which is overseen by our board of directors. Finally, I just want to say that we're also looking at the need to expand this organization and increase the scope of our research as we move more and more into clinical trials. Andrew's going to talk a little bit about clinical trials in some exciting new areas of what are known as Janus kinase inhibitors or JAK inhibitors, as well as CAR T therapies, which is and CAR NK therapies, which we believe have the potential to lead to not only better treatments, but frankly the aspirational possibility of a cure for this disease. So again, I want to thank all of you for being with us and being the backbone of this organization, the lifeblood of this organization, as we continue to expand. I'm always amazed at the kinds of things that a relatively small organization like CureJM has been able to accomplish. As we expand our research program and as we truly attract the best and the brightest doctors and researchers for clinical care and basic and translational research. So thanks to all of you for really giving us as your staff the ability to make that happen, along with our board of directors and our really astounding medical leadership that we have in this organization. We'll have a chance at the end of tonight's session for any Q&A questions that you might have that Andrew or Shannon and I can answer. And I'm happy to turn it over to Shannon Malloy, who I know is well known to all of you on this call. Shannon, over to you.
Great. Thank you, Jim. That is really exciting and really hopeful, I have to say, as a parent. So let me jump forward. I wanted to quickly touch base with all of you about CureJM's Clinical Care Network, because this is something that's a little bit newer. I know a lot of us are familiar with this, but I think it's really important. The mission of CureJM's Clinical Care Network is really to help kids get the best care close to home. So there used to be a time, 15 years ago, when my son was diagnosed, where we really had just a small number of specialists in a few locations across the US. Now, fast forward to 2025, and you can see we have expanded exponentially to, not quite every corner of the United States, but pretty darn close to getting where our families are located so that they can get the best expert care close to home. I have to tell you just a quick story. Many of you provide family support to our new families when they're diagnosed. And the kind of phone calls that we would get 15 years ago was along the lines of, my child's been looking for a diagnosis for 6 months, for 12 months, for a year and a half. The closest specialist to us is 5 states away, 6 states away, a 6-hour flight. And working with those families to try to figure out how to get the best care. Fast forward to today, just this week, we've had 3 or 4 children newly diagnosed who we were able to help get seen by an expert in their area immediately with one of the leading experts, whether it's Jessica Tournier or a Sarah Sabah or a Kelly Rouster Stevens. And those are just near and dear to my heart because I can remember, funding some of those fellowships, funding some of that early research, and really a conscientious effort. I have to give credit to our board of directors for just having the vision to know, 20 years ago, 15 years ago, 10 years ago, investing in that next generation of clinical leadership is now paying off with our new families being able to access the kind of care that, quite frankly, 15 years ago, 20 years ago was really just a pipe dream. So huge congratulations to each of you that has made this possible. And I want to recognize all of you that provide that support to those new families because it really does make such a difference to have that lifeline, and especially to Lynn and Joanne and Randy and Joel and their work with the Grandparent Alliance. It's such an important group that you're there to welcome all of those new grandparents, and it really means a lot. So the other comment I wanted to make, and then I'll hand it over to Andrew. He has much more to say about clinician education. But as a parent, the research that we're working on is so important, and the developments are coming faster than ever, but it still takes time to make research progress. And during that time, while all the researchers are working so hard, our kids are all getting older. So making sure that every kid has access to the best care and every clinician has all the tools and equipment and knowledge that they need to deliver the best outcomes is really at the heart of our mission, not only as an organization, but for the CureJM Clinical Care Network. So I wanted to show this photo because one of the things we are doing as part of the Clinical Care Network is exponentially increasing the funding that we're able to give to local pediatric rheumatology clinics specializing in JDM. So providing funding to the doctor that your child sees, whether they need a piece of equipment, something to look at the nail beds, or a physical therapist to come into clinic, or some specific training that those clinics need. We want to answer those calls, and we want to say, yes, we've got you covered, because we know that delivering care is really at the crux of why we're all here. So we will keep you posted over the coming weeks and months on all of the funding that we're able to give out to the Clinical Care Network. And it's our goal to increase that as resources allow, so that money gets into the clinics that your children are being treated at, and every child can have really access to experts no matter where they're located. And the final thing I would just add is, we know that there's always going to be changing information. And like Jim said, this really is the age of progress. So as that information changes, we're working to get that into the hands of every pediatric and adult rheumatologist so that the knowledge base about JDM Care is not only with the Cure JM Clinical Care Network, but with every rheumatologist. And in fact, we send an update quarterly to all the pediatric rheumatologists in the US and quite a few of the adult rheumatologists as well. So one other comment, and then we'll jump over to more of the research update. Is an important part of JDM Care is making sure that the parents and the teens and young adults have the resources and information so they can participate in the care. There's really no one-size-fits-all treatment for JDM. Every kid needs an individual plan. So there's a lot of ways that families can plug in, and this is something near and dear to our heart, to make sure you all have all of the latest information that your doctors have as well, so you can ask informed questions and really participate in the care. So we'll keep you informed of all of this stuff that's coming up. We have monthly town halls like tonight. We have regional conferences. I know Lynn is going to our Southern California conference on Saturday, which we expect. We have 4 hospitals participating in that event, which will be excellent for our families. And our flagship event, like Jim mentioned, is our family conference, and we'll make sure you all have the link to register for that. And one final event, which I really am so excited about this year, is our second fundraiser of the year, which is our walks. So some of you were gracious enough to participate in our holiday challenge. We're now coming into walk season, which is a fun way that you can participate in Cure JM wherever you're located. We'll get this list out to each of you so that you know how to register. And then Alyssa actually helped us out last year with kind of crafting a fun idea. If you don't live near a walk, we can walk from home. So that's something that we'll be working on, making sure you all have that information as well. These are really fun events where you can come out, the doctors walk, and it's a lot of fun. So we'll make sure that you all have these dates, but coming up quickly, we have Southern California, and then coming soon after that, Pittsburgh, Tampa, Chicago, and the full list will be coming out to you all soon by email. One more plug in case you want to look to see the area near you all where we have a walk. It's really crucial. I think we all know this, but every dollar that we can raise goes straight into helping move all of this important work forward. And we really do owe all of this progress to you all. So if you see your walk listed, we'd love to have you participate. If you want to start a walk near you, reach out and let us know, and we'll help you do that. So with that, I'll hand it over to all the important work that our walks are funding, and introduce Dr. Andrew Heaton, our Chief Scientific Officer.
Thank you, Shannon. Thank you, Jim. I just want to take up on a few points that Jim mentioned. First of all, one of having staff longevity in the organization and really being able to plug into our networks. I've been with the foundation now for some 6 odd years, and over that time, I've really been able to develop some really strong and really deep networks within our pediatric rheumatology group of clinicians. And just to give you an example of how important those networks are, I know some of the board members and some of you were on our Clinical Care Network Summit this afternoon. So the Clinical Care Network Summits, we run 2 a year. And as Shannon and Jim mentioned, they're really about how do we get the rising tide to lift the expertise of all our pediatric rheumatologists. So, we provide these, fairly intense 3-hour programs to help educate pediatric rheumatologists that maybe don't see as many JM patients as some of our big centers. And the comparative advantage we've got in the way we run these educational events is because I'm now so deeply plugged in and entrenched in this network of extremely passionate clinicians. It's like I can call what are effectively world leaders. The presentations that we had today, we had 5 presentations. 4 of the presenters would be keynote address status at any international conference. And we managed to get, and even the guy that wasn't quite keynote, he's not far off being a keynote, Dr. Carve Ardlin. So, having that longevity and being able to plug into these networks, that really helps us, educate the clinical care network. And, we got the doctors to present for free. We get them to do that twice a year. We do this virtually. So because this is all done by Zoom, the costs from a foundation perspective, we're very wise and we're very cognizant of, how we best spend the hard-won money that you so successfully raised for us. So I just wanted to take off on that theme that Jim introduced on, how important it is to have stable staff. But now I want to talk a little bit about what we're doing from a research perspective as well as an education perspective. So the overarching mission that we have is to find, hopefully find a cure, but along the way we want better treatments and we want to improve care and improve lives. So that's our overarching goal. It's like, how do we trickle that down into how do we execute that? So the way we drive and fund our research programs, I want to spend some more time talking about. So if you could just go to the next slide, please. Thank you, Shannon. Accelerating scientific discovery and expediting developments and treatments. So the accelerating scientific discovery is like, we've funded a lot of what we call basic or translational research programs. So the basic research programs, as Jim mentioned, one of the recent programs we funded is Dr. Kurosawa in Japan. And some of you may ask, well, why do we fund somebody in Japan when there are so many great scientists in the USA? And in part, the reason for that is that, JM is still the same disease in Japan, but in Japan, the JM patients have got the same myositis-specific autoantibody, but the way the patients present is somewhat different. So it's like, what is the subtle difference between the patients in Japan and the patients in the USA that we know and understand so well? And how can that help us, try and figure out what is going to be a better cure? And one of the things that we actually did before we funded this Japanese researcher is we actually got her on a call with Dr. Sarah Sabah from Wisconsin, Dr. Jessica Tournier from Michigan, and Dr. Jess Neely from California. So we had some of our rising stars that know and do a lot of basic research actually talk to her about what her program was, and importantly, sharing samples. So that's really sort of important. With a rare disease, you never seem to get enough samples to really understand the disease to try and develop better treatments. And I think, one of the underpinnings that we've got, and we've been so fortunate, is we have really started to bring up a group of the next leaders of JM. And we've been extremely fortunate that we've really picked on some winners. So, we have folks like Dr. Lisa Ryder, Dr. Anne Reed, Dr. Brian Feldman, really senior clinicians at our medical advisory board. But we're cognizant of, we need to keep bringing through the next level of experts. So we've been fortunate to do that. And just to highlight a few of the people that we've brought into the fold, Dr. Jessica Tournier from Michigan, and just to highlight the way she operates is, she runs a dedicated JM clinic at Michigan, and she has a great 360-degree feedback mechanism as to how her clinic works, how it could get better, and what they need to do to add PT, mental health components, etc. But one of the beauties of the way that Dr. Tournier works is that she's so collaborative. It used to be in the scientific community, if you had a good idea, you kept it to yourself. You didn't want to share it because you didn't want somebody else to get funded for it. Dr. Tournier is the antithesis of that. She brought together principal investigators from Duke, from California, and from the foundation, and she was the leading light that got us the Chan Zuckerberg Initiative. So this $2 million grant that Jim mentioned, and it's worthwhile pointing out that there were over 300 applications for this funding, all very good, very strong applicants. The Chan Zuckerberg Initiative funded 5. We were one of the 5 that they funded, which just really establishes, as Jim mentioned, how excellent and what quality of researchers we actually have and collaborate with. So the Chan Zuckerberg Initiative is all about if we isolate not just blood samples from a patient, but if we can isolate blood samples and we get tissue from muscle and we get tissue from skin, how can we correlate what's going on? What do we see in the bloodstream? What do we see in cells in the skin? What do we see in cells in the muscle? So you get a lot of data. So you need somebody that has got like almost an AI type approach to filter this data, to look at what the underlying causes are. And thankfully we have Dr. Jess Neely in California that is, world-class, as you would expect in the Silicon Valley, at doing that sort of deep analysis. So the collaboration that we've got to really accelerate that level of scientific discovery is absolutely outstanding. So that Chan Zuckerberg Initiative, that wouldn't have been possible if we hadn't funded Dr. Tournier several years ago. So, the other thing that we always try and do is collaboration and leverage. So whenever we're funding a project, we always ask the question, is there a way that we can get a multiplication factor from the funding that has been so diligently raised by you all on this call? So examples are the Center of Excellence at the University of California, San Francisco, run by Dr. Susan Kim and Dr. Jess Neely. It's like, while we funded that program, we almost got a dollar for dollar match from the university. So they were able to set up, an absolutely exceptional clinic there. We funded a program with Dr. Melissa Morales in State University of New York, Binghamton. And one of the things we're always cognizant of is when you're looking at accelerating scientific discovery, it's one thing to, develop these programs that give you an indication as to what the underlying causes are. You need to excite drug companies. So when we funded this effort at the State University of New York at Binghamton, we were actually so happy that Melissa was able to get BMS, so Bristol Myers Squibb, on board. They've got 2 interesting drugs that are, one's approved, deucravacitinib, which you may have heard of. It's a TYK2, so it's I think it's called SOTYK2. You'll see the advertisement for it. We're about to start a clinical trial for that drug in JM, and in part, this is due to the collaborations we've been able to form and the leverage we've got from accelerating that scientific discovery. So collaboration and leverage are something that, they're the themes that we're always so cognizant of. As far as expediting development and treatments, the next stage is really clinical trials. So once you think you've got a target, you then look at, well, how can I develop a drug that looks at that target and potentially helps our kids? So some of the things that we've been funding, particularly the State University of New York, we've been looking at this JAK-STAT class of drugs. So, baricitinib, which you may have heard of, and I'm sure some of your kids may be on some of these JAK-STATs. So we're really looking at, is there a difference between the JAK-STATs? Is SOTYK2 going to be any better? So, we're really at the forefront of helping develop clinical trials for those programs. So we do that in collaboration with some senior members of our medical advisory board that work through the NIH. So Dr. Andy Mammon, Dr. Lisa Ryder will be looking at some of those programs in the not too distant future. If I could go to the next slide, please, Shannon. I just want to talk a little bit about two really interesting things that have just come up and just come to our notice literally in the last 2 years. These were unheard of, 2 years ago. And that's what we call the CAR T and CAR NK. Unfortunately, the science world is full of acronyms. I will try and give you a lay summary. So CAR T stands for chimeric antigen receptor T cell. So basically what it is, it's a way that we can take a sample from a patient, we purify it to just the T cells. What we then do is we engineer something on the side of those T cells that's very specific and just targets B cells in the patient that we got the sample from. So we isolate some blood cells, purify the T cells, we put a specific receptor on the T cells, and then we inject it back into the patient. And what it does is the B cells, which are believed to be one of the significant causes of immune system issues, it basically wipes out the B cells, and it's like a reset. So just like you would give your computer a hard reset when you have an issue, this is giving the immune system a hard reset. So we collaborate very closely with a company called Cabaletta. I think there's information on our website on the Cabaletta trial. So it's called CAB201 is the product. That trial is open, and it's open for ages 6 and over in Chicago. There are some other sites that are open. We heard today from a company called Century Therapeutics. Century Therapeutics, one of their chief medical officers is Dr. Ann Stevens. Ann Stevens is a member of our medical advisory board. So, having this deep connection with, world-class clinicians is fantastic. And Ann presented this case for, so CAR NK therapy is chimeric antigen receptor, but it's NKs for natural killer cells. So it doesn't use T cells, it uses natural killer cells. It's a little bit different to CAR T therapy, whereby you don't take blood samples from a patient, purify them, modify them, inject them back in. CAR NK cells, they actually got a sample from one donor a few years ago, and they modified that specific cell line so that it targets B cells. So it's a little bit cheaper to produce. You don't have to take blood samples, so the timings are a little bit less. The balance is always how much do you know about the toxicity associated with these programs. They're both still in their early phases of research. We do know there are occasionally some side effects with these drugs, but they're really exciting, whereby some patients that have been on these therapies have gone in. There was a case in Europe where a child was 12 years old, bedridden, extremely sick, failed 5 or 6 therapies, went in, had CAR T therapy, and literally 2 months later, he was having to be told to cover up when he was playing soccer. That was how dramatic that particular therapy was for that child. But as I said, the issue here is that it's still early days, and we still don't know how effective it's going to be across the range of patients. And certainly as a foundation, we don't advocate for CAR T or CAR NK, but what we do encourage you to do is, speak to your local clinician. They will get some information, determine if the therapy may be appropriate for your specific child and your indication. So it's a really exciting time. There are more trials that are about to open. We know that there's going to be this trial of deucravacitinib, or the SOTIC2, that's going to start in Washington, hopefully early next year. We know that Dr. Lisa Ryder has some more trials that are about to open. So it's a really exciting time, whereby we've had so few clinical trials to try and get therapies approved by the FDA for JM. It's almost like all of a sudden we've got a wealth of riches coming down the pipeline. So we're going to try our best as a foundation to keep everybody informed of what the clinical trials are. And it's really then, have that discussion with your clinician, they'll be able to give you much more information than I can in 5 minutes as to whether they think it's appropriate or not. But it's certainly, it's an exciting time. Next slide, please, Shannon.
I think we're ready for Q&A.
Yeah. Thank you so much for your time.
Stop sharing. Let me stop sharing and give everyone a minute to come off mute. I know there's a few of you that'll have some questions, so go ahead and pop off and let's hear what's on your mind.
Shannon, if I could jump in for just a quick minute before we have, as people think about their questions. I just sort of wanted to leave you all with six points from tonight, and actually earlier today's presentation from our medical leadership, and really looking forward to your questions. But I'd like to just sort of summarize a little bit of what today has been all about, and by mentioning that, that your organization, the Cure JM Foundation, is in fact the leader in pediatric rheumatology care and research. We really have evolved to being that kind of an organization. This research is very much on the cutting edge, as you just heard from Andrew. Your doctors in the Cure JM network have more knowledge about JDM care than we've ever had before. There are 3 to 6 drugs that are excellent candidates in the pipeline for better therapies. CAR T and CAR NK, as you just heard from Andrew, hold the promise to be a cure, but as we also heard today, there's much work yet to be done to reach that finish line. And finally, that our families are our lifeline, and I just can't tell you how grateful I am for all that you do. And with that, let's open it up to some questions. Shannon, we may have some in the chat, or please.
Yeah, I know Luke said he had one. Not to put him on the spot. I've also got a few by text.
Yeah. Great, yeah, Luke.
Sorry, can you hear me okay? I just want to make sure my mic's on. Okay. Hi, everybody. How y'all doing? That's some fantastic news across the board there. I know we've had some conversation about that, but obviously we're all thrilled as family members with all the breakthroughs and upcoming, potential cure. I mean, incredible. I guess I had a statement well, that was the statement, but then I have an idea, and that would be I'm doing this through work right now, but I would think that this could be really useful for us, is to have like all the medical knowledge that we have and the treatments and everything kind of pulled into one place, so that you could just, say use an AI tool like Notebook LM or another tool. There's other ones out there as well. So that way the community can ask questions 24/7 and get the answers, but not have any of that risk of hallucination that you would have with, say, a ChatGPT or something. Because it's only trained on your own data. I think that would be super helpful and impactful for the community, that you could just
that's a great idea, Luke.
On call. Yeah.
Several of our researchers are using AI so we can run that through them, but that's outstanding idea. Great. I love the way that you're thinking forward. And while we have Luke, let me just put in a quick plug. I think you all heard a lot tonight about how Andrew is leveraging every dollar and the difference that your dollars are making. We have 3 big kind of campaigns a year: the holiday challenge and the walks, which you heard about, but also Luke Ryan is the chair of our DIY fundraising committee. So like Lynn's bowling event next weekend, and Todd's bike ride that he did, and James's Skate for a Cure. If anybody wants to talk with Luke about that, we'll make sure you get Luke's email, because it's a really great way to have fun while supporting a good cause. So a little plug for Luke now that you've all seen his face.
Please hit me up. I'll happily do like a brainstorm with you, and tap any tools and resources and media contacts. I know that we did a really nice one with the family out in Alaska. That did the Kicks for a Cure, and that was really fun to kind of put that together with them. And I'll happily do them anytime. Yeah, so definitely hit me up. Be great.
Yeah, so Jim, one question by text from one of our parents who's on mute. I think they've got a bedtime going because it's getting a little bit late for the little ones. When you mentioned the new treatments and a treatment revolution, what are your thoughts about steroids still being the mainstay of what the little kids are using today?
Well, it's really more of a medical question than a director question, but let me just say that that the research community is has moved in a direction. The clinical community, I guess I should say, really has moved in a direction of wanting to diminish steroids in the treatment protocols as quickly as they possibly can. There is my understanding, and please, Andrew, jump in here if I have this wrong, but my understanding is that upon diagnosis, really treatments by steroids, sometimes intensive treatments by steroids are still the best first course of action that we have in most cases. But what is different is that, and as we heard today, that the tapering protocols to really reduce reliance on steroids and replace them with many of these alternate therapies that have been developed over the years is really becoming more of a standard of care, if you will, as doctors realize that long-term reliance on steroids is really damaging to kids. So I think the medical community is more attuned to that than ever, and has done a really good job of listening to parent concerns over recent years, especially now that these alternate therapies, when they work, can be available to children and families.
That's great news for all of us.
If I could just add just quickly, I mean, it is such an important issue, and we place such weight on the use of steroids that we actually dedicated some time in today's summit where Dr. Kaveh Ardalan, who's the co-director of our Duke Center of Excellence, he spoke at length. He actually went over time in his talk today on how do we actually titrate down the steroids in an appropriate manner. But Jim's correct. The current state of thinking of the medical community is the course and the trajectory of the disease is significantly impacted the earlier you can start appropriate therapy. And they still think that, treating it with steroids initially, while it's got those negative side effects, that potentially saves years in the future, where you're on longer term drugs for a longer period of time. So Kaveh presented, a really eloquent story as to, how he's applying steroids, and he's at one of our centers, and that was something that was very educational to our broader clinical care network. So unfortunately, they're still front and center, but with what we're doing with CAR-NK, CAR-T, deucravacitinib, and other potential steroid-sparing drugs, we're definitely trying to move the needle away from them.
Mm-hmm. That's great. So Nicole is asking about the CAR-T clinical trial in Chicago. So yes, Nicole, right now, actually we have both CAR-T and CAR-NK trials in Chicago. So ages 6 and up. We'll provide you with the contact information, Nicole, but it's being run right now at Comer Children's. So that, is right there in Chicago. Also, being run for ages 18 and up at other locations, but I know she's not quite old enough for that. So 6 and up at Comer Children's, and more sites to be open soon for the pediatric part of the CAR-T trial. So we'll make sure that you all get the lists of all of these trials and research participation opportunities. One other question by text, and I'm not sure which one of the three of us wants to answer this. I'll probably hand it over to you first, Jim, from somebody who lives in one of the areas that doesn't currently have a clinical care network location. What are our thoughts on expanding our locations?
Excellent question. What I can say is that personally, as your as your executive director, that priority to expanding to other locations. I'm not sure where you are, but expanding to other locations where there's not a clinical trial network, particularly in populated areas of the country, is really among my highest personal priorities. Again, as Shannon was saying early on, relative to the clinical care network, if you look back, 10 years, there were just a handful of doctors that we would be confident had the ability to provide the highest quality care. We're significantly greater than that now, but I'm also acutely aware that there are areas of the country where CureJM and the clinical care network does not have an adequate presence, and in some cases any presence at all. A couple of those locations, include population centers in the Midwest. They include the state of Florida, for example. So a very high priority, and in fact had a discussion with a board member about this today in terms of our board's willingness to really fund the expansion of the program, because we can't get into some of those huge states or huge geographic areas where we want to be without having the resources to recruit, engage, and fund those doctors. So stay tuned. I think you'll see some positive movement in those areas, and send me a note and let me know where you are so I can make sure I cover your area.
Yeah, and I would also add, some of that takes time. So in the meantime, looks like we've got bedtime at Luke's house too. Yeah. So in the meantime, there's a lot of other levers that we can help families and clinicians pull as additional consultations might be needed by Zoom. We can do telemed sometimes with some of our clinicians. We even have one of our clinicians who during COVID drove to the border to treat patients who couldn't cross state lines, but wanted to provide the best possible care. So reach out to me or Andrew or Jim, and we can help connect on an individual basis what options might be available. Worst case scenario, we could always work on some travel plans. There are organizations that can help with flights and accommodations, so we're happy to assist anyone that reaches out. But in the meantime, absolutely, we'll keep you posted on new locations, new partnerships. And I do have to commend Andrew again, bringing together hundreds of clinicians for a 3-hour training today. And this training is available to all clinicians in our clinician library at any time. So really working hard to make sure every clinician has the same information.
I think it's slightly allied to the clinical care network and our outreach. Is the other thing that we try and do is we try and encourage those pediatric rheumatologists that are thinking as to what they want to specialize in. We now we've generated a 3-layered approach. So we had a very close consultation with our medical advisory board, and it's like, how do we educate those pediatric rheumatologists that may not want to be a JM specialist, but they get some training in it? So we've got, what we call immersion light programs, where a fellow can go and visit one of our leading clinics at one of our centers for a week or two to get some exposure. We've got immersion heavy, as we call it, where a fellow could go to one of these really exciting sites that's doing a CAR T or a CAR NK site, really gets some deep-rooted knowledge in the clinical trial process and JM specifically. So we educate those, and those clinicians don't necessarily stay where they're fellows. They start infiltrating throughout the lower 48 inevitably. So we're big sponsors of that continuing education and ensuring we've got the next crop of fellows that have got exposure, and we leverage again off the expertise that we've been able to develop through your funding as a foundation, the Lisa Ryders, the Ann Reeds, the Jeff DeVergtons. We ensure we make the most of that by training the next level of fellows that are coming through. So while it's not a direct clinical care network, what we're doing in the fullness of time is like we're trying to get everybody to have some JM expertise. We're biased, of course, but we want to try and do that.
And one final thing I have to commend Andrew and his team for doing was setting up a listserv, which has clinicians who can share ideas, collaborate, talk about difficult cases. And this is really one of those ways that you practically create collaboration so that kids can learn from the experience of all the clinicians across the country. So just so much progress. Well, with that, I think we're out of time. So let me hand it back over to Jim for any closing remarks. And then as you all think of questions over the next couple of days, get them over to us. We'll get them answered by the right experts and get you back and answer quickly. But we're very grateful for you all. And let me hand it back over to Jim to close us out tonight. Oh, I think you might be muted, Jim. There you go.
Yep. Thank you, Shannon. And I really think I sort of drove home my 6 closing points a little bit already, but really just want to underscore that we are here for you. That is really, the underlying reason why CureJM exists is that we are here for you. So anytime you need to reach out to Shannon, to any member of our staff, to me, to Andrew, please do. We want to hear from you. We want your ideas. We want you to be engaged, and we want to know, how you're doing and how your children are doing. So please stay engaged. It's so important to us, to your staff, to our board. I'm thrilled to see that we have so many of you on the phone tonight, on Zoom tonight for this for this session. We'll be having more regional conferences. I've already mentioned our national conference. Shannon's gone through our walk program, so there's ample opportunity for you to be involved with this organization in any way that works for you. So please let us hear from you, and just looking forward to continue to serve you and your family's best interests. Thanks for being with us tonight.